Welcome everyone. My name is Lisa. I'm one of the physiotherapists here at the University Health Network in the lung transplant program. And today we're going to go over our exercise program with you. And this exercise program includes three main types of exercises: stretching or flexibility exercises, aerobic exercises, and strength training. We would like you to do this program at least 3 times a week. If you have been prescribed morphine or another opioid by a palliative care doctor to manage your cough or shortness of breath, we recommend that you take a dose an hour before you start the exercise program. Some of these exercises can be done either in standing or sitting. We would like you to do the exercises in standing whenever possible, unless your physiotherapist has specifically asked you to do them in sitting. We recommend having a family member or support person in the house when you are doing your exercises. If you experience a coughing spell during exercise, stop and rest until it is passed. If at any time you experience pain in your chest, neck, arm, or jaw, nausea, lightheadedness or dizziness, or any visual changes, stop exercising immediately. Discuss with your physiotherapist or doctor. If the symptoms do not resolve with rest, go to the emergency room or call 911. All right, we're going to get started. I will have Denise and Giselle come on up. So to start, you're going to sit and rest for 5 minutes, and then take and record your oxygen saturation and heart rate if you have an oxygen monitor. Great. Now we're going to start a short warm-up. A warm-up helps your body adjust from a resting state to exercise by gradually increasing your breathing, heart rate, and body temperature to prepare you for a higher level of activity. Before starting the warm-up, make sure that your oxygen setting is at the level that you've been asked to be used for exercise. Some people may need to wear a different oxygen device with exercise, such as a mask. Your physiotherapist may ask that you use continuous oxygen device from a portable tank when exercising instead of from a pulsed oxygen from your concentrator. The first warm-up exercise are shoulder circles. Giselle will demonstrate these in standing, and Denise will demonstrate them in sitting. So swing your arms forward in large circles 10 times. You will repeat that backwards 10 times. Great. The second warm-up exercise is high stepping on the spot. If you're doing this in standing, have a chair or a counter or your walker close by in case you feel a little unsteady. You're going to lift your knees up to your waist level, if able, at a moderate pace. If this is too hard, you can sit and lift your knees, as Denise is showing here. 10 times each leg. If you feel breathless or fatigued, have a short rest. Now we're going to move to the walking session. To prepare, we would like you to do calf stretches from a standing position, as Denise will show here on the treadmill. You will hold the stretch for 15 seconds and do this twice on each leg. Please note how straight Denise is standing while she does this stretch. And she wants to make sure she doesn't bounce during the stretch, but get a nice prolonged stretch in her calf that does not cause pain or discomfort. And she'll repeat on the other side. prolonged 15-second stretch. So before starting to walk, make sure you're using the right amount of oxygen, as some people may require a higher amount or a different oxygen device with aerobic exercise or endurance exercises. Ideally, we would like you to use a treadmill, but if you do not have one at home, you can walk in a long corridor or in a circuit inside your house. Use a rollator walker if you need to carry your oxygen and have a seat available for rest. You can also stand in place and do stepping on the spot, as Giselle will show. Your physiotherapist will give you a targeted speed and time, distance, or number of steps to walk. This is typically 15 to 30 minutes of walking per session. If you find it very difficult to walk continuously for this length of time, you can break up the sessions into 5 to 10 minute intervals with rest in between. Make sure you record the number and length of any rest that you take. At the end of the walking session, or at any rest breaks, take and record your oxygen saturation, heart rate, and shortness of breath on the Borg scale. In general, the recommendation is to maintain an oxygen saturation of 88% or higher with aerobic exercise, but your physiotherapist may give you a different target. The Borg scale for shortness of breath should generally be between 3 and 4. Giselle, can you show on the Borg scale what area we would like people to work in? Now, your physiotherapist may give you a different target. If you are below your Borg range, we may ask you to increase your time or walking speed. And if you are above your Borg range, we may ask you to slow down or add a walking warm-up and cool down. Remember that if you are walking outside, there may be small inclines that you cannot see, and that can increase workload significantly. Wind resistance can also increase workload or effort. To progress, it is usually recommended to first increase the time of exercise before increasing the intensity or speed and or incline. Now we're finishing our walking session, and we will have you take and record your oxygen and heart rate reading immediately after stopping, as well as rate your shortness of breath on the Borg scale. And now sit and rest for at least 5 minutes. So following the rest period, we're now going to do some upper body stretches. If you find doing pursed-lip breathing helps when you do exercise, then use this technique. Otherwise, breathe as you like. Denise is just going to demonstrate pursed-lip breathing now. Your physiotherapist can talk to you about specific breathing exercises that may help you. Next, we're going to go to 3 more stretches, and we'll have Giselle demonstrate this in standing, and Denise will demonstrate them in sitting. So the next one is side bending. So Giselle is going to stand tall. You're going to tighten your abdominal muscles, lift one arm up, and bend over to one side. Then you're going to repeat this to the other side. And you're going to want to do this 10 times in each direction. The next one is the overhead stretch. So stand or sit up nice and tall. And you're going to lift both arms forward and up 10 times. Denise is going to do this while demonstrating pursed-lip breathing, and Giselle will do it as she breathes comfortably. Make sure you do the exercises at your own pace, and rest in between any exercises as needed. The next stretch we're going to do is chest expansion. Here you will place your hands behind your neck and bring your elbows in front of your face together. And then bring your elbows out to the side. You're going to do this 10 times, using a breathing technique that you find helpful to you. Any of these exercises and stretching, always let your physiotherapist know if you have any shoulder, neck, or knee issues, and we can modify them. Great. So now we're going to progress to cycling exercise. So I'll have Giselle go over to our bike. And again, you would use the type of bike that you have available to you at home. If your bike has the ability to record workloads such as watts, we would like you to record that. Otherwise, record the time that you're using. If you have a small foot pedaler that you cannot increase the tension and you find it is quite light, your physiotherapist may ask you to add some light ankle weights while you're pedaling. The general target is 15 to 30 minutes of cycling, but if you find that very difficult to cycle continuously for that time, you can break up the sessions into 5 to 10 minute intervals with rests in between. Make sure you record the number and length of any rest that you take. At the end of the cycling session, immediately take and record your oxygen saturation, heart rate, and shortness of breath on the Borg scale. A general recommendation is to maintain an oxygen saturation of 88% or higher with aerobic exercise, but your physiotherapist may give you a different target. Again, as with the treadmill, the Borg scale for shortness of breath should generally be between 3 and 4, as Denise will show here, but your physiotherapist may give you a different target. If you are below your Borg range, we may ask you to increase your time or the cycling tension and or speed. But if you are above your Borg range, we may ask you to slow down and add a cycling warm-up and cool-down at a lower tension. To progress, it is usually recommended to first increase the time of exercise before increasing the intensity. Now we're going to go ahead to the strength training exercises. Denise is going to demonstrate with an elastic exercise band, and Giselle is going to demonstrate with leg weights and arm weights. Before we start, correct form or posture is very important. The general recommendation is for one set of 10 repetitions where the effort feels somewhat challenging by the last few repetitions. As the exercise becomes easier, increase the weight by 1 pound or do 2 to 3 sets of 10 repetitions. It is good to have a day rest or alternate training the upper and lower body to avoid muscle injury and provide time for your muscles to adapt and get stronger. You can use a variety of equipment, including hand and ankle weights, as Giselle will show, and elastic exercise bands, or even weight machines or pulleys if you have those available to you at home. Do not strain or hold your breath when lifting weights, but rather focus on your breathing for each movement and count your repetitions out loud. So Giselle and Denise are demonstrating the bicep exercise. So again, we want to start with your elbow straight with your hand near the floor, and slowly bend your elbow up to bring your hands towards your shoulder, keeping your wrist straight, and then lower back down. If you are sitting like Denise is doing, make sure you are forward enough in your chair so that your arm can go straight. The next arm exercise is the triceps. So you're going to straighten your arm up over your head and bend your elbow so that your hand approaches your shoulder. Your elbow should not drop. You can use your other hand to support your exercising arm to make sure it does not come forward when you do this exercise. And Denise is demonstrating with the band. To make this harder with the band, she would add more tension to the band by decreasing the length. All right. The next exercise we're going to do is a sit-to stance. So you will want to find a stable chair in your home, so nothing that has wheels. So Giselle will demonstrate from a standard chair height. And you are going to cross your hands over your shoulders and stand up fully, and then sit down 10 times. Do this slowly so that you can sit and control yourself going slowly back down into the chair. So 10 times, nice and slow. So a progression on this exercise is the squats. So once you can do the sit to stand exercise easily, you will work on this exercise. You want to stand up tall with your feet shoulder width apart. As you squat down, your bottom should move backwards like you are going to sit in a chair, and your head should come over your knees. Your knees should remain over your toes and only go down to a half squat. Your physiotherapist may ask you to hold small hand weights during a squat as Giselle is doing, and you can also modify it with the elastic band like Denise is showing here. It might be helpful to do this in front of a mirror to look at your technique while you do this exercise. Again, 10 times is recommended. Now we're going to do a series of 5 strengthening exercises for your legs. The first one is the quadriceps. So you're going to sit in a chair. And again, Giselle is going to demonstrate this with ankle weights, and Denise is going to demonstrate this with elastic exercise bands. So sitting in a chair, you're going to extend your leg out straight, but keeping your thigh on the chair. Hold this position for 3 seconds. If you don't have a weight or an elastic band, you could try to hold for longer, for 5 to 10 seconds. Or if there's any technical difficulties, as Denise has had. And again, we will do 1 set of 10 repetitions, and that will be done on each leg. Now the next one we're going to do is hip flexion. So you're going to stay seated in a chair, and you're going to bring one knee up and down 10 times. As this gets easier, Giselle may add a heavier weight to her ankle, and Denise could tighten that band up to make it a little more tension, to make it a little more difficult. The next 3 exercises need to be done in standing. So you want to have a chair or a kitchen counter nearby for support. Again, your physiotherapist may ask you to do these without any weights to start, or with ankle weights, as Giselle will show, or an elastic band, as Denise will demonstrate. So the first one is hip abduction. Standing tall, lift one leg out to the side while keeping your trunk straight. So do not bend to the side. Giselle is going to show the incorrect technique of bending to the side when she does this exercise. And now she's going to correct and stay nice and tall and do it the correct way. You will do 10 times on each leg and then repeat on the other side. The next one we're going to do is the hip extension. So standing tall, bring one leg out behind you while keeping your trunk straight. So you can see how Giselle and Denise are nice and straight. What you want to avoid is not bending forward, as Giselle will incorrectly demonstrate right now. You want to be nice and straight. She'll do the correct technique now. And we'll do 10 times each leg. Now, we'll do one more exercise. Because these exercises are done in standing, you might feel that you need a break after each one, or after a couple, and that is fine. The last one we're going to do is the hamstring. So you're going to stand tall, and you're going to bring your foot back, keeping your knees together. So we don't want that knee to come forward. So, Giselle, do you want to show the incorrect technique of that knee coming forward? So, do correct technique. Now, keeping the knees together and just extending back. And again, that will be 10 times each leg. We have one final exercise, and these are the step-ups, which Giselle will show in a moment. So we'll go over to the stairs. Just get ready. So you will find, if you have some stairs in your house, preferably with a railing so that you can hold on if you need for balance, you are going to slowly step up 2 steps and then go back down. Again, using the railing to steady your balance, but not to pull yourself up. Your physiotherapist may ask you to add some small ankle weights when you do this exercise. It's important to remember that step-ups are a higher intensity exercise, so you may need to use the level of oxygen you were using for the treadmill or the bike. And Denise is showing how you can incorporate pursed-lip breathing if that is a technique that is helpful for you with these exercises. We usually recommend doing 10 times, but again, if you find after the 5 repetitions you're tired, you can stop as Denise is doing now and just catch your breath. You can sit if needed. So a standing or seated rest, and when you feel your breathing is more under control, you can add and do the next 5. Great. Now, good news is exercise program is all finished, so you're going to sit and rest for at least 5 minutes. And you're going to take and record your oxygen saturation and heart rate. If your heart rate is significantly higher than at the start of exercise program, then wait another 5 minutes and then recheck. Please let your physiotherapist know if any of the exercises cause musculoskeletal pain or irritate any joint pain or arthritis that you have, or a pre-existing issue with your back. It is not uncommon to have some delayed muscle soreness over the next 24 to 48 hours, especially if you have increased the amount of weight you have used, or if you have started an unfamiliar exercise. If this happens, take a rest day before restarting, and you may want to decrease the weight by 1 pound. Thank you very much, and thank you to our lovely volunteers and our video recorder, Dimitri Rosenberg. Flip it around.